for me and you is a lie.
Oh yeah,
Take me to the center.
good for a brother.
Take me to the center.
Where are you, Mtungo? Where are you, Mtungo? Oh, the pain. Oh.
That must be Mtungo's new baby. With all that noise, I know why he's never home.
Mutungo has a child.
Yes, about a week ago. They're there at his home.
His wife gave birth from home.
I don't know. I think so.
Is Mutungo there?
He's away fishing.
Have you seen the baby and the mother?
For what? Are they mine?
Let us go and see them.
Why? We are training. Those are Mtungo's problems.
Come, we'll continue training after. Mutungo's house! Get help!
Fire! Fire! Someone help! Open the door! Come and help! Fire! Mtungo's house is on fire! Fire! Hurry! Come! Come!
You go to Mama Brown and bring more jerry cans.
The baby! I'm going to get the baby!
Watch out! Water, be careful! Water! Go soil! Bring soil!
Bring water!
Bring the soil! Bring the soil! Oh, move! Move! Come on, move! Move! Go! Move! Move! Have you seen Mrs. Mutungo? Have you seen Mrs. Mutungo?
No.
Don't go in! Don't go in! You move with the fire!
We need a stretcher. Anything. We need to take her to the health center.
You're supposed to get 6 injections. Do you fear injections? That is not my problem. Don't cry for me here. Even remove those tears. What are you doing?
It's all right. It's all right. Injections do not hurt. It's okay. I've had them and I'm fine. Am I not?
Are you the one who cleans here? Livingstone! Livingstone, come here quickly.
Monday, have the people from the district health office come yet?
I haven't seen them.
Remember to show them in to me when they arrive, eh? Me only. Don't take them to the doctor, clear?
Yes, Mr. Wilberforce. Livingstone! Livingstone! You come and clean here.
Yes, madam.
Hurry.
Mandy, what is Dr. Sophia doing?
Why don't you go and see?
Is Mr. Wilberforce seeing any patient?
You. Why do you want to know?
The reception area has been full of patients since morning.
Is it your job? If it is disturbing you, why don't you trick them?
Monday, Jean, what are you doing?
I'm taking this patient to Dr. Bagal.
Why? Is it your job?
No, but the reception area is still so crowded.
I've been here since morning, and that lady keeps us there, and we sit here the whole...
I'll look after this patient. Go and do your job and let Monday do hers. Come on.
can you people do things like this? Eh? Don't you have toilets at your place, you people? Don't you even know that we have toilets outside?
Take them outside and show them the toilets. They don't seem to know how to use them.
Yes. We go and I show you the new latrines that Mr. Banda built for us. You come. All of you stand up and I take you. Your places will stay there. Eh? If you come out in a line, then you come back in a line and sit in your places as you went. You, madam, you'll be first in the line. And then you, and you. Madam, you will not lose your place.
You, get up. If you don't, me, I won't show you to the doctor. Do you want to dirty in our place? Go!
You, like this. Eh? Marching in a line. You don't get out of the line, stay in the line. Ah. Left, right, left, right, left.
Driver, do you know where the health center is?
I've been there only once.
Mr. Magola, do you know where it is?
They say it's near a cafe. The Sparrow's Cafe.
Sparrow, I know it.
The center is opposite it. By the way, Mrs. Talemwa.
Yes?
Has the new doctor arrived?
No, we didn't receive any information on that. We only got a reply from the clinical officer, Mr. Wilberforce Muchoke, telling us that they would be waiting for us, but he didn't give us any information on the new doctor's arrival.
Good morning, Innocent.
Good morning, Dr. Bagara.
Is everything okay here?
Yes, madam.
Monday, have you seen Mr. Wema? Has he reported to work yet?
I don't know.
He's late. This is not acceptable. Oh, Hope, Jean, how is the little one? Is he okay?
He's just got his first injection and it didn't hurt, did it? Will you come back tomorrow for another one? My, aren't you a brave boy?
Oh, that's great. Where are all the patients?
They have gone.
So quickly. Well, I haven't had anything to eat at all. Do you know a place I can go to and have a cup of coffee or something?
Sparrows across the road.
Thank you.
Bosco, open up. We need to take her to the center.
Hey, what's wrong with her?
She was in a fire.
Hey, quickly, put her in.
Another Renzori water, please.
Can I please have a cup of coffee with milk on the side? A cup of coffee without milk in it, but also a smaller jug of milk on the side. I'll mix it myself, nothing else. Thanks.
You woman, you are here. When we left, you are here. Now, why do you start to park it? Hey, you don't park on the grass. Don't park on the grass. You move your vehicle outside there or there, but don't park on the grass.
Thank you, Mr. Wilberforce.
Oh, my pleasure.
Good morning.
Good morning.
We are from the District Health Services. Can we speak to Mr. Muchoke, please?
Oh, good morning, madam. Morning, sir. I'm Mr. Wilberforce Pikchacho Muchoke. I'm the clinic officer here. I'm in charge as the doctor is not here.
Okay, I'm Mrs. Talemwa.
Oh, morning.
My colleague, Mr. Magola.
Oh, morning.
Good morning.
The doctor hasn't arrived yet?
Oh, she arrived, but she's gone out.
Okay, can we have a talk? We need to discuss the Yellow Star program.
Oh, yes. We can use my office. Is clear of any patients? Oh, it's this way. Come with me.
Thank you.
Is this my order?
Yes.
But I asked for coffee without milk in it.
Yes.
And a jug of milk on the side.
Yes.
There is no milk.
No.
And there is a donut. I did not order for this donut.
You don't want something to eat with your tea?
No. I ordered coffee with separate milk.
Yes.
So, can I please have some milk?
It is not cooked.
Well, it's okay. I'll just have this. Without the donut. Oh, please, excuse me. This is tea. I asked for coffee.
But there is no coffee, as we have only tea. It happens frequently here, so it's not just you. The cafe doesn't sell coffee because not many people drink it. It's a tea town, much to my husband's disappointment. I'm Miriam Banda.
Sophia Wagala.
Ah, the new doctor. I've heard about you.
I can't imagine what you've had.
I can assure you, you made quite an impression on my husband. Zachary Banda, you met him on your first day.
Oh, yes, Mr. Banda.
So, how is it working at the center?
It's okay.
I'm in charge of the Konoweka Business Women's Association. Do you think you could come and speak at one of our meetings? Talk about your job, what its importance to the community, what we can do to help the health center, that sort of thing. I can assure you they don't bite.
Thank you. I would like to. Oh, that must be an emergency. Please, excuse me. What happened?
She was in a fire. The house burnt down.
Do you know her name?
Mrs. Mutungo.
Where's her husband?
He was away. He's a fisherman.
And the child?
He was crying, but I didn't see any injuries.
Did you examine them both?
There was no time. We just thought to bring them here as quickly as possible.
Okay.
As part of the Yellow Star program to improve quality of care, we are going to support you. We'll be coming back every 3 months to see how the health center is meeting its targets.
Yes.
It's not an exam. We'll just need to assess how you're coming along. At the end, if the health center meets all our requirements, it will be awarded a Yellow Star.
Oh, yes, I understand, Madame Tarimwa. I have a very good team. You know, a good health center is one with good staff. My staff is very good. Definitely deserving of a Yellow Star.
That is very good, Mr. Muchoke. But of course, we'll need to meet all the staff today.
Madam, I'm not sure. You know, we are so busy.
Perhaps in 2 groups, so that we don't stop the good work.
We could actually start by meeting the members of your health unit management team.
Oh, yes. Yes, and I could show you our wonderful facilities. The latrines. Thanks to our LC3 chairman, Mr. Zachary Banda, and the community, we now have brand new latrines and they are working. Oh, my word, yes.
She's not burned, thank God, but she has lost a lot of blood.
The baby is fine. I've examined him. His umbilical cord was becoming septic. I've cleaned it. He's also underweight. I don't think she has been breastfeeding him well. Otherwise, he's okay.
I wonder why she didn't come to the health center sooner. She's obviously had this infection for several days.
Most women of here, once they deliver, they think that's the end of the clinic. You tell a mother, come back 6 days after delivery. She says yes, but never comes back.
You should always make it clear that serious problems can occur for the mother and the baby. During the first week after delivery, that's when most deaths from childbirth occur.
I always tell these people.
Don't say always tell these people. This woman delivered, and it is obvious she was not on her way here.
I think you're overreacting.
I don't think I'm overreacting. This woman has a fever. She's bleeding, and her baby's cord is septic.
That's why we always insist that mothers and their babies should come here for examination during the first 6 days. That's when most problems are detected and handled early.
You don't have to shout at me.
That is because you shouted at me. I'm an old woman, and I don't need any of that.
This is Amania's surgery room. Oh.
Mr. Wilberforce, what's the meaning of this?
Dr. Sophia, this is Mrs. Tarimwa and Mr. Magola. They are from the District Health Services. They came to tell us about the Yellow Star program.
Please accept my apologies. I was not made aware of your coming today.
But Dr. Sophia, we informed weeks ago. The letter was placed on your table. Maybe someone removed it. You should take care whom you let into that place. There are important documents kept there, you know.
Thank you, Mr. Wilberforce. I'll make sure I check on it. I trust my clinical office has taken good care of you.
Oh, yes, he has. And I can see you have a patient you're busy with.
In the meantime, we could meet more of your staff. Your dispenser, for example.
Oh, yes. Mr. Innocent is a very efficient fellow. The ministry has supplied us with all the drugs we need. And with that kind of stuff like Mr. Innocent and the good doctor here, everything is well and truly managed.
That's good, Mr. Muchoke. So I believe all the stock records will be up to date then.
Oh, I'm not saying we don't have occasional problems.
I'm so sorry, Sister Gertrude. I shouldn't have shouted at you. Please forgive me.
It's okay, but please don't do it again.
Good morning, Mr. Banda.
Morning.
You want to see Dr. Bagara?
Yeah.
Even Mr. Wilberforce is there with the district people. They all come to speak.
Good morning, Mr. Band.
Morning.
I was just telling these good people about the new latrines you organized to be built.
Oh, yes, we are doing our best to help. And anything the community can do for the health center.
Yes, first, I would like to introduce our LC3 chairman, Mr. Zachary Banda. This is Mrs. Tarimwa and Mr. Magora.
Hello.
Hello.
They are from the district health services. They came to tell us about the Yellow Star program.
Oh, yes, the Yellow Star. We are sensitized about that. You're welcome.
Thank you.
So what's the verdict?
Well, we are yet to find out.
Give her vitamin A as soon as she regains consciousness. We'll also give metronidazole 500 milligrams IV 8 hourly, Ampiclox 500 milligrams IV 6 hourly, for the next 3 days.
Yes, doctor.
By then, she should be feeling well enough to go home and complete her course of antibiotics from there. Do we know where her husband is?
He's working, but their neighbors will tell him. He will be here, don't you worry.
I have to talk to him. Next time, she should give birth from the health center, where we can look after her properly.
And make sure she comes back with her baby for checkup, yes?
Yes. Thank you.
Good morning.
Good morning.
Good morning.
How much is a cup of tea?
Only 200 shillings. Tea with milk.
Give me a cup of tea with milk, please. Thank you. That's a nice baby we have there.
Thank you.
Are you here with baby for checkup?
Oh, yes. These people you see here, they know what they are doing, I tell you. As soon as my baby was born, it was immunized. Then they told me to come back, and I was here immediately after 6 days. They checked baby, checked me, weighed baby. I tell you, what didn't they do? You see my baby. Doesn't my baby look good?
Yes, it looks very good.
6 weeks later, I am here again.
That is
very good, but some mothers are funny. You know, they don't come back. Me, I can't understand why a mother shouldn't bring back her child to be checked. That's why my child looks so nice and healthy.
You're very responsible, madam.
Yes, I am very, very responsible, me. You should see how people look at me and whisper, nice baby, wonderful baby. And you know, I don't blame them. You also see the baby for yourself. Is it bad looking?
No, not at all.
Let me know who gets on your mind like the man. Nada, you need it, you get hit like a easy. Touch me and tease me. Let me know, ma. Let me know. Do you feel me?
Mr. Weber, can you please turn that music down?
What?
I say turn the music down. Mr. Weber, don't you think that that music is a bit too loud and disturbing?
Is that what you came to tell me?
Well,
if it is, thank you. I've got the message.
I had actually come to say thank you for saving Mrs. Mutungo and her baby's lives. Mr. Lutentes,
Yes, Madam Doctor.
Are those the stock cards?
Yes.
Are you updating them?
Yes.
Can I take a look at them?
But you have not finished.
That shouldn't be a problem.
But you have not finished. And Mr. Bafos has to send them first.
I don't think that is necessary when I am around.
But that is what Mr. Bafos said. Speak to him first.
Very well. I will certainly speak to Mr. Wilberforce about that.
What are you saying?
I am saying I have an appointment. And you know I have an appointment because I've been here before to have an appointment.
What do you think this is? Your home. When the midwife is ready, then you shall see her.
What is going on here?
I'm telling this nurse I have an appointment and she's just being rude to me like always.
Monday, is this true?
She's lying.
Me? Such wickedness.
Monday, I cannot allow such behavior. You must treat all our patients with care and politeness. I don't want ever hear of another incident like this one. Understand?
Man, what are you doing distracting my grass? You must have a regiment of wounded at least.
Another one they stopped me for in the road. His wife is the one who set fire to the hut. He came home, fainted.
No, I'm all right. I'm all right. It was the shock. Where's my wife and son?
You come, I'll show you.
Mrs. Kajansi, it's good you've come back. Oh, and baby looks so well. You still breastfeeding him?
Only milk. He can drink and drink and drink. But me, I only give breast milk. The nurse told me it's the best.
That is true. For the first 6 months, you should only give breast milk.
Okay.
But now, I think I should weigh him so that we make sure he's growing well.
Hey, he's crying.
Don't worry, Mrs. Kajansi. He knows what I'm doing. He's okay. We've done this before, haven't we?
I think he enjoys coming here to be weighed.
He's a beautiful baby. You see? He's gaining weight very nicely.
That's good. He takes after me.
Has he been immunized already today?
Not yet, sister.
Okay, I'm going to immunize him now, and you will need to bring him back 3 more times.
I know.
Mr. Banda, good morning.
Morning.
Mr. Mogola, Mrs. Talimwa, has Mr. Wilberforce shown you everything you wanted to see?
Oh, yes.
I'm sorry for not being able to be with you.
That is okay. We know that you're very busy. And Mr. Wilberforce has been of much help to us.
Well, the place is less hectic now. We can move to my office. This way, please.
Thank you.
Thank you.
Hope, Jane, please tell Moses, Gertrude, and Innocent they should come to my office. Mr. Band. Mr. Wilberforce, please see to that patient. She has been here all morning.
Very well, doctor.
Well, Mrs. Mutungu, why didn't you come to the health center after the baby was born for checkup?
I thought everything was fine.
We could have helped you. You know, the first 6 days after delivery are so critical. That's when most problems often occur.
I'm sorry.
Here's baby Daudi. Oh, he's a little underweight. You will need to breastfeed him whenever he's hungry. Until he's 6 months old, just give him breast milk, okay? Nothing else to eat or drink. Mr. Mtungu, your wife and baby were in a fire, and your wife here has an infection of her womb, which we are treating. They'll both need to stay here for the next 3 days while we treat your wife.
How is the baby?
Oh, the baby is fine. Your wife needs to breastfeed him more often. And of course, remember the immunizations.
Okay, sister.
Okay, Mr. Mtungu.
Thank you very much.
Okay.
Thank you.
Our job is to assist you in identifying your priority problems and help you come up with plans to solve them. Then it will be our joint responsibility to make these plans happen. So let us look at the standards, please.
The health facility looks clean, with water, lighting, and excellent sanitation.
Your medical treatment is very good, and your staff are very competent. Your record keeping needs some improvement, however. And your dispenser was uncertain about his stock of drugs. I think you should look into that.
Thank you, Mr. Mogola. Mrs. Talemwa.
Please continue. Do not allow me to disturb you.
Thank you, Mr. Wilberforce. Please be seated. Now, I believe we should choose 2 members of staff for our quality care team that will help us here at the facility to achieve the Yellow Star standards.
That is very important.
I would like to include our midwife, Sister Gertrude Nsi. And for the second member of the team, Mr. Wilberforce, I think you will agree with me that we need a young, active member of staff, Mr. Moses Wema, our lab technician. He is a bright young man, and he has proved that he cares about the center and the patients. The first few weeks after childbirth are particularly dangerous times for the mother and the baby. That's why mothers should come with their babies for checkups 3 times after childbirth. The first checkup should be done within 6 hours, the second checkup after 6 days, and the third visit 6 weeks after childbirth. If we can raise the quality of care, more people will use our services, and then the health of the whole community will improve. Our new quality of care team will make a difference, I'm sure.
Take me to the center.